right, y'all, and welcome back to the Mike Riley Now podcast. I am Mike Riley here with Cameron, my girl Charlie, and my girl Brooke. Hello, everybody. I cannot wait to get you some headphones there, Cameron and Charlie, so that way y'all can hear this beautiful music that, I'm playing through here. Everybody says my voice on that. You listen to the Mike Riley Now podcast. Sounds like one of those late night, midnight jams, brothers. Like, yeah, ladies, this goes out to you. This one's for all of you. I'll take that. All right, y'all. Welcome back to the Mike Riley Now podcast once again. Make sure you go on MikeRileyNow.com, subscribe, do all that cool stuff. So this is the economic portion of our show, and what I really want to talk about today is the Affordable Care Act, aka Obamacare, aka Hillary Care before it was Obamacare, aka Romney Care, aka Roosevelt Care, because there's been all kinds of people who have been trying to kind of implement some healthcare reform in this country, right?
What's up with the last name care thing? Like,
I don't know. It's just like gate. It's like every time there's a controversy,
I want my name stamped on that.
Yeah, it's something gate, something care. Like like whenever something happens now, it's something like phone gate, email gate. Email that was all after Watergate.
E-gate.
Yeah, you know what I'm saying? Big gate, metal gate.
Little
anyway.
Gate. Gate.
I always find myself in conversations with people, both liberal and conservative, who express pretty much their disdain for the Affordable Care Act. For the most part, a lot of people are like, man, my premiums went up. I can't afford it. I'm forced. Now we're mandated to have health care. And if we don't, then we're going to end up getting penalized for it year after year. And on top of that, recently it was just announced, because the open enrollment for Obamacare is actually going to be coming up here pretty soon. I think it's actually starting next week. And today he actually did a kind of like what we're doing right now, where he took questions from people and he answered questions about the Affordable Care Act. But the premiums are going up. Next year, it was stated that people's healthcare costs, if you're not getting healthcare from your employer, if you have private health insurance, your healthcare costs are actually going to go up, and it's going to actually hit you in the pocket. Now, this is pissing a lot of people off, and it's actually one of the big talking points for Donald Trump. See, I told you the Affordable Care Act wouldn't work. We're going to repeal Obamacare and replace it with something better. Yeah.
What exactly?
Yeah. He wants to get rid of state lines so more companies can compete or whatever.
He just knows he doesn't want that.
Yeah. Now let's dissect this for a second. Now, when it comes to healthcare, what do you think as a country we should do, both economically in a way where it's cost effective, and at the same time in a way where people can be looked at? I think the first thing we have to ask ourselves is healthcare a right or a privilege? Right. Now what's the difference between a right and a privilege? Like, right, you have the right to live. You have the right to
remain silent.
You definitely have the right to remain silent. We have our rights kind of stated in the Bill of Rights, right? And then you have privileges, right? Like driving a car is a privilege, right? Because hell, you can be dangerous and you may not be suitable to drive. Owning a gun is a right as opposed to a privilege for some oddball reason, but that's a
God knows why.
Yeah, that's a question for a whole nother conversation. But before the Affordable Care Act came around, healthcare was considered just a privilege. If you have money and you can get yourself checked out, but if you get sick and you're broke, well, you're kind of assed out. And if you're sick, an insurance company probably won't take you, or if you have a pre-existing condition, an insurance company won't take you. Or if you do get sick and you are on insurance and you hit your cap, then they can kick you off the insurance and you're on your own. And they didn't have to provide, preventative care measures for women and, all kinds of horrible things. So the Affordable Care Act changed all that. But at the same time, a lot of people say, well, it just raised our premiums up. And look, our premiums are going up again. Thanks, Obama. Because of you, our healthcare system is worse than it's ever been, Now, I kind of want to address a couple things here. First of all, why are the cost of our premiums going up? A lot of people really don't know. A lot of people just point the finger at the president and they say, well, it's because he sucks and he just didn't do a good job at it, right? first of all, one of the main reasons the healthcare costs never got balanced out the way it should for the Affordable Care Act is because a lot of the states that have Republican governors wouldn't take the Medicare exchange or the federal Medicare expansion package. In other words, they were trying to expand federal Medicaid to all these different people so low income families can get healthcare, and they wouldn't take it because they let the states set up their own exchanges. And why are the healthcare costs going up right now? Well, kind of for the same reason. It's not like the government has control of the health insurance industry, is it? They don't control drug prices, do they? No. The government is just there to kind of regulate and mandate things, but health insurance, for the most part, is still in the hands of private entities. So if your health insurance premiums are going up, that's because private insurance companies are raising your healthcare costs. Now, why are private insurance companies raising your healthcare costs?
Because they like money.
Pretty fucking much. That's pretty much what it is. I mean, it's not like insurance companies are suffering out there, are they?
Yeah. It's not they're going, oh no, now I have to pay more for my healthcare.
Right. And a lot of these insurance companies now are getting off of Obamacare. They're trying to kick it to the curb now. And this is another big Republican talking point to the "see, I told you it wouldn't work" type of rhetoric. And a lot of them are trying to do what AT&T and Time Warner are doing right now. And they're trying to merge, become even bigger healthcare companies.
A monopoly.
Right.
A monopoly,
You know, and they're trying to do this whole thing. So you see that this is not necessarily something that's, you know, the fault of the POTUS himself, but a lot of these insurance companies that are just greedy, and they're not in the business to see you get better, or to see you, to see you not get sick, but they're mostly just in it for the profit. Now you can kind of look at it from a perspective. Now, do you feel like that's right? Do you feel like that's okay as far as people's healthcare is concerned? Do you feel like the healthcare industry should be a for-profit industry?
Of course not. It's absurd to even consider it, and I mean it's unthinkable that this is the culture and that this is the system that we have to live with as Americans. It is a basic human right to be able to live another day.
To live, I mean...
so then why are we putting a cap on people being able to live another day? It's just like...
You're putting a price on human life, essentially.
And then you're jacking up the cost if they do want to fucking live.
Yeah.
I mean, think about we pay more for prescription drugs in this country than any other country, not any other country, but any other developed country in the world. I mean, we pay the most for prescription drugs. What's that guy's name? Martin Shkreli, who would charge like $500 a pill for like a pill that helps people out with HIV and AIDS or something like that. Yeah. I mean, and they're allowed to price gouge. They're allowed to do that.
Yeah, and why are you telling me what I need to get in order to be okay? Ask your doctor this. No, my doctor will tell me what I need because he should care about my health.
Right. And same thing with the hospital, same thing with a lot of these doctors. My father passed away back in 2009. And he was pretty, he wasn't doing too well towards the end of his life, and from an economic standpoint. And he didn't have health insurance. And he had a bad back problem. He was taking this pill, that I later found out was was killing people. I don't remember the name of the medication. But he was taking it for his cardiovascular problems, and this pill was making him sick. So he goes to the doctor because his heart rate starts to speed up, and he goes to the hospital, and he didn't have health insurance. And I personally think they just let him die. And because they'd rather let you die than to sit there and say, well, not all hospitals and things like that aren't like this, but that just goes to show you that this idea of if you're poor, and if you don't have the money to take care of yourself, you're just kind of assed out, and how that spills over into our healthcare system. As you don't necessarily have the right to live. It's pretty disturbing.
It's utterly despicable.
And if we truly have and you're inevitably going to get sick or get hurt. I mean, you're human, right?
Especially
if you're us. Yeah, we're very accident prone.
Right. You're just preaching to the choir. So don't you think that health insurance should be a basic individual right? Just out of curiosity. Now, I know a lot of people out there saying, well, man, I'm young, I'm cool, I don't take any stupid risks, so I'm not going to get sick. And why should I have to pay for somebody else to get health care? Just because they don't feel like working or whatever. I mean, that's that standpoint, right? So if that's the case, and if a lot of people believe that, and I know a lot of people do, what do you feel is the best solution to this problem? Because we can't go back to the way things were, right? So what do? Hillary Clinton has proposed what is called a public option. Now, do y'all know what a public option is?
Not especially.
Not especially? Okay. It's kind of like this. I'm trying to get a good example of what a public option is. What's a good example of a public option? I'll just make one up. Okay, back in 2000, Al Gore was campaigning on this idea of the internet, right? Wi-Fi, the internet, because in other countries you practically breathe internet. Like if you go to China and Japan and stuff like that, they got Wi-Fi everywhere. It's just in your blood.
Yeah.
And according to Jill Stein, it causes, cancer or whatever. I'm just joking. I love Jill Stein. But Al Gore was proposing this idea that the government, the United States government, should have an internet system, right? Now, of course, where people can log on to, let's say your Wi-Fi says United States government Wi-Fi. Now, all of these people, all of these big cable companies like Verizon and Time Warner and Cox and all these, they were just like, no, you can't do that. Government takeover of the internet, blah, 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 blah. Why? Because they didn't want to have to compete with the government. Because they know that the government's not going to sit there and gouge you and charge you an arm and a leg for basic services. They're there to provide you with just the services. And most people, if they know the government's offering a cheaper, better option, are going to take the government option. Yeah. They're going to take the public option.
And buy by wealthy private organizations.
And it will sink the big companies down, and they don't want to do that, and they know that's true. You add a public option, which is what Hillary Clinton is proposing, into the healthcare bill. Imagine what that does. Now, you can choose between here. We live out here in LA, or in California rather. In California, you have a couple options for healthcare, which is funny because you only got like 3 of them.
Yeah.
It's the healthcare industry it turned just like the phone industry is turning into, or the communications industry is turning into. You get to choose from 5 companies basically, as opposed to a conglomerate of different providers. But here in California, we have Anthem Blue Cross, Blue Shield, or something like that. But you can also go for Covered California, which is the state mandated health insurance. But imagine if the federal government had a health insurance option, and it was just as good as you got from Blue Shield or Blue Cross, but it was a fraction of the price, and it was paid for through our tax dollars. Wouldn't you take that?
I can answer for everyone. Yes.
Yeah, I think I would too. Now, go to any other developed nation in the world, like any other Scandinavian country. Their taxes are a little higher, right?
Yeah.
Right? Their taxes are a little higher.
Everything else is so much better.
But damn, they make up for the amount that they're paying more in taxes. That's pretty much the same thing you'd be paying in healthcare costs anyway, right?
Yeah. And you're getting so much more.
And you're getting so much
more.
So you pull an extra, $150 out of my check every month, but I'm paying $250 a month for health insurance. So really, what difference? And that way, everybody gets health insurance. Not just the privileged few. So this public option that Hillary Clinton is proposing is something that, of course, all of the big insurance companies are
despising.
Are trying to fight against. They're trying to call it a government takeover of healthcare, and a lot of people are saying, why should I have to supplement other people and do all these other things? I mean, what really is how is that American? How is that something that we look at from a standpoint of democracy? Democracy states that we're all in this together, not just from a social standpoint, but from an economic standpoint as well. And healthcare really, really, really affects the economy, especially since we spend more on healthcare in this country than any other nation on earth. Why is it that our healthcare system is kind of shackled down like this? I think a public option would be a good idea.
I think it sounds like a fantastic option.
Yeah.
I think it's a universal agreement right now.
Yeah.
Yeah.
Universal in the sense of 3 people, but close enough.
Yeah.
Right. And
I'm very cool people.
Very, very cool people.
Yeah, 3 okay people. Well, 2 okay people and 1 amazing, awesome guy.
Oh, thank you, Mike.
Yeah,
Excuse me?
sweet of you to say that.
Yeah, well, you know.
Two?
Yeah,
Yeah, see, right here. This mic.
Yeah, this mic.
Over here.
But I am curious to know what y'all think out there too, listening. I mean, what do you think about the healthcare system? Do you think a public option would be a better idea? Or do you think we should go back to the way things were before? Where, if I smoke or if I got cancer before, I can't get health insurance. Or if I get sick, I'm just asked out. Or if I'm working a job that doesn't pay well enough where I can't afford to have health insurance and whatever else, or my kids get kicked off of my health insurance when they turn 18 and they're on their own. Kind of curious to know what y'all think about that. So write me, go ahead and drop us a line. You know where to do that at MikeRileyNow.com, and let us know what you think about the whole health thing. So yeah. And I personally think a public option would, in the long run, be way better for our economy too. So, but we'll see how that happens. Anyway, all right, y'all. Well, that is our show. Thank you so much for tuning in, everybody. Thank you so much for subscribing. God bless Cameron. God bless Charlie. God bless Brooke. And God bless all of y'all. And to quote a great scholar, remember, democracy is not a spectator sport. It starts with you. Tag your it. You got to get involved, y'all. All right. God bless you. Cheers.
Cheers.
You are listening to the Mike Riley Now podcast on the Young Angels of America Network. Follow us by visiting MikeRileyNow.com.